Top 20 NHS Support Worker Interview Questions and Answers. Preparing for an NHS Support Worker interview? These top 20 questions and sample answers will help you understand what interviewers expect, boosting your confidence and helping you succeed in your NHS journey. 1. Tell me about yourself and why you want to work as an NHS support worker. I'm a compassionate, reliable individual with a background in care work, dedicated to supporting people in vulnerable situations. My previous experience in community care taught me the value of empathy, patience, and attentive service. I'm drawn to the NHS because I want to contribute meaningfully to patient well-being, ensuring people receive the care and dignity they deserve. I enjoy hands-on work and find fulfillment in making a difference in someone's life. The NHS values align with my own, and I'm eager to join a team where I can grow while positively impacting patient experiences every day. 2. What do you understand about the role of a support worker in the NHS? A support worker in the NHS provides hands-on assistance to patients, helping with personal care, mobility, feeding, and emotional support under the supervision of healthcare professionals. The role ensures patient dignity, comfort, and safety while contributing to their overall care and recovery. Support workers also assist with record-keeping, observing changes in patient behavior or health, and communicating effectively with nurses and families. The job requires empathy, patience, teamwork, and strong communication skills. It's about delivering compassionate, person-centered care, respecting patients' rights, and maintaining professionalism at all times within a busy and diverse healthcare environment. 3. How do you uphold NHS values in your work? I uphold NHS values by treating everyone with respect, compassion, and empathy. I value diversity and inclusivity, ensuring that every patient feels seen and heard. I work collaboratively with staff, prioritize patient safety, and always strive for high standards. When providing care, I act with integrity and honesty, ensuring confidentiality and trust. I listen to patients' needs, deliver person-centered care, and remain committed to continuous learning. Whether it's helping with daily tasks or offering emotional reassurance, I act in a way that reflects the NHS values of compassion, respect, excellence, and accountability in every interaction. 4. How would you support a patient with limited mobility? Supporting a patient with limited mobility begins with assessing their individual needs and following the care plan carefully. I ensure a safe environment by removing obstacles, using mobility aids properly, and applying safe moving and handling techniques. I communicate clearly, reassure the patient, and encourage independence where possible. Maintaining dignity is key. I ask for consent before any assistance and keep the patient informed during every step. I also monitor for any signs of discomfort or pressure sores. My approach focuses on safety, respect, and enabling the patient to feel supported, not dependent. 5. Describe a time when you had to deal with a difficult patient. I once cared for a patient who was verbally aggressive due to confusion and frustration from dementia. I remained calm, kept a safe distance, and spoke in a gentle, reassuring tone. I listened patiently, validating their feelings without arguing. Over time, I built trust by consistently responding with kindness and maintaining routines. I also informed the nursing staff and documented the behavior appropriately. My calm, empathetic approach helped de-escalate the situation and allowed the patient to feel more secure. I learned the importance of patience, nonverbal cues, and adapting communication to each individual's needs. 6. How do you handle emotional or distressing situations in a healthcare setting? In emotional or distressing situations, I remain calm, composed, and empathetic. I listen actively to patients or families, offering reassurance and comfort while respecting their emotions. If I feel overwhelmed, I seek support from colleagues or supervisors to maintain professionalism. I understand the importance of not internalizing stress, but instead using coping strategies such as deep breathing or taking a brief pause when appropriate. I also attend debriefings or reflective practice sessions to process difficult experiences. My focus is on providing steady, compassionate care while protecting my emotional well-being to stay effective in the role. 7. How would you maintain a patient's dignity and privacy during personal care? To maintain dignity and privacy, I always ask for the patient's consent before beginning personal care and explain each step clearly. I use screens or curtains, keep the patient covered as much as possible, and only expose areas being cleaned. I speak respectfully and avoid discussing personal matters loudly or publicly. I maintain confidentiality and treat every patient as an individual, with kindness and empathy. I respect their preferences and comfort levels and never rush them. By fostering trust and preserving dignity, I help patients feel safe, respected, and valued during their most vulnerable moments. 8. Can you describe your experience working in a team? I have worked in both healthcare and community settings where teamwork was essential. I communicate openly with colleagues, share responsibilities, and support others during high-pressure times. For example, during a particularly busy shift, I collaborated with nurses and other support staff to ensure all patients received timely care. We divided tasks, checked in regularly, and maintained clear communication, which helped the shift run smoothly. I respect others' roles and know that good teamwork improves patient care and reduces stress. I'm always willing to learn from others and contribute positively to a supportive, respectful working environment. 9. What would you do if a patient refused care or medication? If a patient refuses care or medication, I first ensure their safety, then calmly try to understand the reason behind the refusal. I listen without judgment, provide clear information about the importance of the care, and reassure them. I never force care but respect their autonomy and involve a nurse or senior staff if needed. I would also document the refusal and any relevant observations. If appropriate, I might revisit the conversation later when the patient feels more comfortable. The goal is to balance respect for the patient's rights with the responsibility to safeguard their health. 10. How do you manage your time and workload during a busy shift? I begin by reviewing the care plan and prioritizing tasks based on urgency and patient needs. I stay organized, plan ahead, and adapt when situations change. I communicate effectively with colleagues, delegate where appropriate, and support the team to ensure all care is delivered. I check on vulnerable patients frequently and keep clear records to avoid repeating tasks. If the workload becomes overwhelming, I inform the shift leader to reassess priorities. Time management in healthcare is about staying flexible, remaining calm under pressure, and ensuring every patient still receives safe, person-centered care. 11. Describe a situation where you had to follow a care plan. While supporting an elderly patient recovering from a stroke, I followed a detailed care plan that included mobility assistance, feeding support, and scheduled medication times. I ensured consistency by checking the plan before each shift and recording all care activities accurately. I used mobility aids as instructed and monitored for signs of distress. When I noticed the patient's appetite declining, I reported it to the nurse, leading to a timely intervention. This experience showed how essential care plans are for maintaining consistent, safe care and how closely following them can make a real difference in patient outcomes. 12. How would you respond to a safeguarding concern? If I notice or suspect abuse, neglect, or harm, physical, emotional, or financial, I would follow NHS safeguarding procedures immediately. I would remain calm, ensure the immediate safety of the individual, and report the concern to my supervisor or designated safeguarding lead without delay. I document facts objectively without assumptions. If a patient disclosed something to me, I'd listen supportively without probing, reassure them, and let them know I must pass it on to keep them safe. Safeguarding is about acting swiftly, responsibly, and with empathy to protect vulnerable individuals and uphold their rights. 13. How do you deal with stressful situations or emergencies on the ward? In stressful or emergency situations, I stay calm, think clearly, and follow protocols. I prioritize patient safety, alert the nurse or emergency team, and assist within my role, whether it's providing reassurance, clearing space, or fetching equipment. I avoid panicking and maintain focus on immediate tasks. After the event, I document what happened and attend debriefings if available. I also reflect on the situation to improve future responses. Remaining calm and effective under pressure is vital, and I believe preparation, training, and teamwork are key to managing emergencies professionally and compassionately. 14. Why is infection control important and how do you apply it? Infection control prevents the spread of harmful bacteria and viruses, protecting patients, staff, and the wider community. I apply it by following hand hygiene protocols, using PPE appropriately, cleaning equipment after use, and disposing of waste correctly. I stay up to date with training and report any hazards immediately. I also maintain good personal hygiene and encourage patients to do the same when possible. Infection control is part of daily care routines and vital for safeguarding vulnerable people. Adhering strictly to these procedures ensures I contribute to a safe, clean, and healthy care environment. 15. How do you handle confidential information? I treat all patient information, spoken, written, or digital, with the utmost confidentiality. I never discuss patient details in public areas or with unauthorized individuals. I store records securely, log out of systems when not in use, and follow NHS data protection policies. If someone asks for information they shouldn't have, I politely decline and refer them to the appropriate authority. Maintaining confidentiality is not only a legal requirement under GDPR but also essential for earning patients' trust. I always ensure that personal data is shared only on a need-to-know basis and documented responsibly. 16. What would you do if a patient made a complaint about you? If a patient complained about me, I would remain calm, listen attentively, and acknowledge their concerns without becoming defensive. I would apologize if appropriate and aim to resolve the issue respectfully in the moment. I would report the incident to my supervisor and document it accurately. Feedback, even negative, is an opportunity to learn and improve. I'd reflect on my actions, consider how the complaint arose, and take steps to ensure it doesn't happen again. Respecting the patient's right to voice concerns is important, and I strive to provide care that builds trust and confidence. 17. How would you support patients with dementia or mental health conditions? Supporting patients with dementia or mental health needs requires empathy, patience, and clear communication. I use calm, reassuring language and maintain routines to reduce confusion or distress. I ensure a safe environment, listen actively, and validate their feelings without judgment. I adapt care based on their mood or behavior and involve family or specialists when necessary. I also observe closely for changes in condition or behavior and report them. Respecting their dignity and treating them as individuals is key. My goal is to build trust, reduce anxiety, and promote comfort while delivering consistent, compassionate care. 18. Have you ever had to report an incident or concern? What was your approach? Yes, while supporting a patient, I noticed a pressure sore that hadn't been documented. I followed the incident reporting procedure, informed the nurse on duty immediately, completed the necessary incident form, and ensured the patient received prompt care. I documented the facts clearly without assumptions. My approach was professional and focused on patient welfare. Reporting incidents isn't about blame. It's about safeguarding health and improving service quality. I always take concerns seriously and act in line with policy, knowing it contributes to safer care and prevents future risks. 19. What steps do you take to ensure good communication with patients and staff? I use clear, respectful, and simple language when speaking to patients, adjusting my communication style based on their needs, such as using visual cues or written notes if necessary. I listen actively, maintain eye contact, and ensure patients feel heard. With staff, I provide accurate handovers, report concerns promptly, and collaborate effectively. I confirm understanding to avoid mistakes and use appropriate documentation. Good communication reduces confusion, enhances teamwork, and improves patient safety and care quality. I also remain approachable and professional, promoting trust and strong working relationships across the team. 20. Why do you think you are suitable for this NHS support worker role? I believe I'm suitable because I have the compassion, dedication, and resilience needed to support patients in challenging circumstances. My experience in care settings has equipped me with hands-on skills, and I understand the importance of dignity, respect, and person-centered care. I work well under pressure, follow protocols, and adapt to changing needs. I align with NHS values and take pride in delivering safe, empathetic support. I'm also a strong team player and an excellent communicator. I'm eager to learn, contribute positively to a healthcare team, and make a meaningful difference in patients' lives. Thanks for watching. If you found this helpful, like, share, and subscribe for more NHS interview tips. Best of luck with your support worker interview. Your compassion and care can make a real difference.